Enemas. Enemas. There's so many types of them. Which one should you use? Doesn't it confuse the hell out of you? You're at your wit's end and you've got poop stuck up your butt and you can't get it out. Well, my friend, an enema can help dislodge that stubborn poop. In this video, I will review some of the common enema brands and the differences between them. This way, you can decide which one works best for you. I'm Nurse Wong, and this is Butt Talks. There are so many sizes of enemas ranging from 5 cc's to a whopping 1000 cc's in a bag. Lower volume enemas means less stretching of the rectal muscles. There are dangers of using too much enema fluid since it can send the poop back up your digestive tract. Besides having too much fluid in your colon, it'll take more time for your poop to move out along with stomach cramps. Who needs that? Depending on your doctor's recommendation, it can range from 5 cc's to 200 cc's each time. Anything above 300 cc's can result in an unpleasant side effect. Let's talk about the different liquid enemas and what each one does. Saline enemas. One of the most common enemas uses mild salt solution to loosen up the stools. The concentration of saline is 0.9%, which is a gentle friend to our anal rectal area. Since salt can be absorbed in the rectum, be careful not to overuse it if you're on a salt-restrictive diet. If you have other health conditions such as kidney disease or a heart condition, consult with your doctor first before using it. If you have pain or vomiting using a saline enema, seek medical attention immediately. Glycerin. Does that word sound familiar? Yes, it's the same ingredient found in suppositories, except it's a liquid solution that comes in a small squeezable enema bottle. It can stimulate your butt to loosen up and soften your poop. The difference between the saline enema is that the usual size is 100 cc's versus the glycerin one that has only 7.5 cc's. Some people might find this volume to be too low for their needs. PD, or children's enemas. Even children get constipated. However, it is recommended that a low volume enema of 2.5 cc's of glycerin is safe for children. Children's enemas are lower volume since the child's rectum is smaller than adults. Administer only one enema with the guidance of your child's healthcare provider. Don't overdo this behavior. Children should not rely on enemas to poop. Children should learn how to poop naturally on their own. If this is a persistent problem, please consult with your healthcare provider. Mineral oil. Mineral oil is used to expand the lower anal and rectal area so the poop can slide out easily. Since it's oil-based, it can be a little messy afterwards due to the leakage and cleanup. Leave a wad of toilet tissue or wear a pad between your butt cheeks to prevent leaking into your undies. Enemas. This contains the stool softener medication called ducosate sodium. It only contains 5 cc's of this ingredient, but some people find it very helpful in flushing out their stool. This often works for patients with spinal cord injuries whose anal muscles have atrophied and are unable to poop on their own. Prescription enemas. These are the ones prescribed by your healthcare provider. They contain medications specific for certain rectal conditions, such as inflammatory bowel disease. Usually they're made with steroids, but there's a limit. So talk to your doctor to know how frequently you can use them. Empty over-the-counter enema bags. You could buy an empty 1-liter enema bag at the drugstore. This is used occasionally for high-volume enemas for certain people, but I don't endorse this as a standard enema method. Instead, I prefer the low-volume enemas. I don't recommend using large reusable bags over a long period of time, but I do recommend setting an expiration date after a limited amount of usage. To avoid bacterial complications, thoroughly clean your bag and tubing between each use. Get yourself a new one if you notice any deterioration. Remember, enemas are meant to be used temporarily if you have trouble getting your poop out. Once the poop is out, you can focus on improving your gut health to keep that poop train going. Watch Butt Talks for more information. Your gut and butt will thank you. If you like our video, press the like button below. Comment on what you want to learn more about next. For more tips and tricks from Butt Talks, subscribe to our channel. Have a great poop day!